We spoke to Denosa, a nursing union, a little earlier, painting a very bleak picture about the challenges nurses face. This facility will hopefully not see any of that happen.
This indeed is a facility that is the example of best practice, Shahan, where there are obviously world standards in terms of safety, and obviously the point of this facility then is to improve the safety standards for both patients and healthcare practitioners by obviously enforcing that importance of education of young doctors coming into the system and making sure that there's that teamwork of working in a system that's obviously promoting a healthy, safe working environment. Now, to talk more about the perspective from the public health sector in terms of both the nurses and doctors, I'm joined by a representative from Hospersa. We obviously focused on a lot of the safety measures here being put in place because of the preventing of spreading of infectious diseases like TB. And you tell me now that the tuberculosis spreading in South Africa is a crisis. Just talk to me more about that from a healthcare perspective.
Yes, thank you. It is a huge crisis currently because it's affecting a lot of our health professionals out there. South Africa has been rated the second highest when it comes to infectious diseases like TB amongst the health professional, and we are losing our professions at a very alarming rate due to the negligence of government that doesn't want to actually focus more on prevention measures and things like that. Then our other challenges would be the long working hours of our doctors out there, and not just them, but also our nurses out there. Due to the big shortage of staff, which is a national crisis, our members out there is expected to work long working hours. The doctors especially, they have to work 30 hours, and I mean, that's impossible. They're just human beings, and yet the department, national government expect these guys to perform a good service to the community out there. And from a humanitarian point of view, our view is this is impossible. The overtime policy nationally needs to be reviewed and revised as a matter of urgency. Then our other challenges would be faulty equipment. That is also another big problem nationally at various tertiary hospitals. Yet again, you expect the patients out there to receive the best care, but how can doctors perform their functions properly if they have to deal with faulty equipment and things like that? So we've met with the Director General at the National Department of Health. We've even handed over a memorandum at the Department of Labour, yet nothing has come from that. We are urging national government to do something as soon as possible, because why we know there's a huge shortage of health professionals, but yet we are doing absolutely nothing to prevent them from exiting the system.
Now, when you talk about faulty equipment, can you give us some practical examples of what exactly or what is lacking in terms of equipment in many of the state hospitals?
Some incubators at various facilities, there's a problem there, and I mean, even isolation rooms where people that have these extreme TBs, there's no air, there's no ventilation, proper ventilation, no extractor fans. Those are just your practical examples, you know, that's out there, and it's a reality. It's not working. And yet and that actually contributes to TB being spread even more faster, you know. So the departments must go, the Department of Health, National Department must go back to the drawing board, look at all these things, you know.
And just lastly, a comment on this particular launch. What does Hospersa feel with regards to this promotion of educating safety first?
No, we welcome the idea. It's very important to us. We need to educate, because prevention obviously is better than cure. Let's all take hands. We are willing to take hands with the National Department of Health and to educate not just doctors, but also all types of medical staff, from the cleaners who must be out there to clean the blood and those type of things. So from our side, it's a warm welcome to the proposal.
Thank you so much. That was Hospersa, the union representing both doctors as well as healthcare workers and nurses, talking about some of the challenges, Sean, the overtime working of staff as well as the lack of equipment. And once again, this launch, the first in Africa, is an example of best practice. But obviously the importance is that it needs to be rolled out throughout the country and actually implemented.
All right, thanks for that. Appreciate it. eNCA reporter Aarti Narsee in Cape Town.